Hi everyone, my name is Phoebe and I'm now in my second semester of Family Nurse Practitioner School. In today's video, I'm going to show you guys what my clinical rotations are like working in a primary care clinic. So right now, we're in a COVID-19 pandemic and things have been different in the clinic. So usually I would see about 20 to 25 patients a day, but now I only see like 2 to 4 patients a day, and that is just because we want to keep the patients at home as much as possible. So we've been taking a lot of telehealth phone calls and just monitoring our patients that way. Without further ado, this is the video of my clinical rotations. So this is what the primary care clinic looks like when you first come in. This is my preceptor's office, and this is where we chart patients' notes and discuss about the cases. I'm sure you guys know what a patient's room looks like. It's really simple and clean. There is a computer in every room with a program called eClinicalWorks where I can access any of the patient's information. Before entering the patient's room, I would go ahead and look at the patient's chart and review anything that needs to be addressed. So I'm going to try to show you guys as much as I can without giving away any patient confidential information. This is a schedule that tells us how many patients we would see in the morning and afternoon and their reason for coming in to visit. So when you click on a patient, you would see their chief complaint, which is their main reason for visiting, the HPI, which is the history of present illness, and this is where I write a more detailed note of their main problem. Scrolling down, you can see the medications they are currently taking, what medications they have taken before but they're not taking anymore, any of allergies that they may have, whether they have any past medical history such as diabetes or hypertension, and of course any surgical histories or if they have been pregnant in the past. You could also review their social history, which includes any smoking or alcohol use. And ROS stands for Review of Systems, and this is where we would ask the patient to identify any signs or symptoms that the patient may be experiencing, and this could be throughout the entire body. This section is used to chart the physical exam, which is what the provider obtains after assessing the patient in person. Before entering the room, I would knock on the door. Then I would introduce myself and ask how the patient is doing and what brings them in today. I always have to bring a stethoscope with me whenever I enter a patient's room. Now with the COVID-19 pandemic, we are told to wear N95 masks and goggles. I'm going to simulate an office visit by using a website called iHuman. My school recently started using this program to simulate clinicals during this pandemic, and it has been pretty helpful. There are so many patients to choose from with different chief complaints. This patient, for example, is a 65-year-old woman who presents with complaints of lower back pain. You can first observe that her skin is warm and dry. I always start off by asking, "How can I help you today?" There are a variety of questions you can choose from, and you are graded based on which questions you ask are relevant to the situation. I am able to obtain vital signs and perform any specific exams. I can also plan assessments and view any diagnostic tests. Based on this patient's presenting symptoms and tests, I diagnosed her with a disc herniation and followed up with a written plan in which I was given feedback and a case summary. This way, students can still practice on patients even though some clinicals have been canceled or pushed back because of COVID-19 precautions. After asking the patient all the necessary questions and performing a physical exam, I would go back to my preceptor's office to discuss about the patient. If there are no other patients waiting, I would go ahead and chart my notes. is usually just a bunch of clicking since a lot of the signs can be auto-populated. Well, that is the end of this video. I hope you all are staying safe and healthy. Be sure to subscribe and like this video if you want to see more. Thanks for watching!